Welcome to the Langford Academy. Today we're going to talk about cerebrospinal fluid. Firstly, why we take cerebrospinal fluid. Secondly, the practicalities of how we take the sample. And then lastly, we can talk about sample interpretation and how we then handle the sample that we've obtained. Firstly, why do we take cerebrospinal fluid? So really it's for any concern I have over disease within the central nervous system. So it's particularly good for screening for inflammation and infection, whether that's within the brain, the spine, or the meninges, so meningitis. Sometimes if I have concern, particularly over cancers in the central nervous system, for example lymphoma that exfoliates its cells quite well, can be a useful diagnostic tool. It's important to think about when it's appropriate or inappropriate to take cerebrospinal fluid. So before we talk about the practicalities of how, we'd like to talk about the considerations of when you should or shouldn't take the sample. So the main contraindications of taking cerebrospinal fluid are particularly if there's any concern over raised intracranial pressure. So when you're taking cerebrospinal fluid, most commonly you take it from the cisterna magna, so behind the brain, or the lumbar cistern at the base of the spine. And you need to have a cavity with that fluid to be able to sample with your needle. So if you have any raised intracranial pressure, whether that be secondary to inflammation, a tumour, what can happen is the brain might herniate, and that means that that spinal fluid space has gone. It's now filled with brain tissue, and it means you can cause harm when you take your spinal fluid. So generally I would try and avoid taking spinal fluid on anything that I have a really high suspicion that might have something structurally wrong with the brain, certainly without doing advanced imaging of the brain first, whether that be an MRI or a CT scan. The other times I would be really considerate are if I've got any concerns that the anatomy of either of those areas is abnormal. For example, the classic thing would be a little chihuahua, for example, that might have atlantoaxial instability. When you flex the head, you can actually cause damage by changes to those bony structures. So I'd just be mindful that the anatomy is as it should be and that you've not got any considerations there. Finally, I would just make sure that the patient can clot its blood and has no predisposition for bleeding. So for example, making sure it's up to date with its lungworm and checking if you've got any consideration that it has sufficient platelets too. It's always important to discuss these risks before taking any procedure with the owner. Quite helpfully, there's been a study recently that's shown that the complication rates are thankfully very low. So out of several thousand dogs, the complication rate that's significant is 0.15%. So it's quite a low number, but all things that you should be mindful of before you take the sample. Secondly, it's just being mindful of the size of your patient and how much spinal fluid you plan to take. So generally for diagnostic purposes, you usually need at least 0.5 ml of spinal fluid to be able to run meaningful interpretation. But you are limited to the size of your patient. So as a general rule, you can take about 1 ml of CSF per 5 kilos body weight. So just be mindful if you've got a puppy or a small kitten, for example, you might be a bit restricted on how much spinal fluid you can take. This is just equipment for aseptic preparation of the skin. So some clippers to clip the fur nicely, some dilute Hibby scrub to clean the skin initially, and then just before we take the tap, we also use some surgical spirit on the skin. What we'll also need ready is some sterile gloves, and then we'll need a 22 gauge needle. The length of the needle varies depending on if we're taking cisternal or lumbar CSF. So taking cisternal, we'll use a shorter 1.5 inch needle. And then your collection pots, we use 2 half mil EDTA tubes, and then your lab submission form, and then something to label your pots with.